A recent report by RSPH highlighted the impact social media is having on the health and well-being of younger people. An all-party parliamentary group on social media and young people's mental health and well-being has now been set up to see what can be done to make that impact a more positive one. Carolyn Sim went to Westminster to see the group in action.
This group are all too aware of the negative impact social media can have. As young health champions from Wigan, they've come to Westminster to talk to MPs about the damage sites can do to mental health and well-being.
People just put the perfect life on, when in reality that's not always what it's like. So you then want this perfect life and want to look perfect. So I think when you're looking at that every day, it lowers your self-esteem.
They're seeing images of what's portrayed as a perfect body and they're realising, well, I don't look like that. So they've got less confidence in themselves.
It just carries on for hours and hours through the night. I wake up with messages and sometimes I'm thinking, what was that conversation about? But it's because it's in the middle of the night, it affects my sleep for in the morning.
The scale of the problem was brought to light in a recent report by the Royal Society for Public Health. It found social media is contributing to feelings of anxiety and depression in young people across the UK. It's now set up an all-party parliamentary group to tackle the issue. It's hoped the group will come up with solutions which will drive changes in policy and lead to the introduction of an industry code of conduct. By acting on the negatives and maximising the positives, it's hoped social media will become a far healthier phenomenon.
So I think in terms of calls to action, we've been informed quite a lot from our young people we've spoken to that things like pop-up heavy usage warnings would be great. You know, outlining maybe when filters have been used on posts, for example, on Instagram, if a photo has been quite heavily manipulated digitally, it would be probably helpful for users to see that and understand that that's not reality. Not everyone looks like that.
Other young people that we're targeting relate to us more, and it'll sort of make them think about their use of social media and sort of start a chain reaction of people wanting to use it less.
But social media has many positives as well. It connects people to friends and family and acts as a platform for sharing information and advice.
I have a medical illness called colitis, so there's many pages on Twitter what are formed around that. So I go on the UK colitis and Crohn's page and it helps me connect with other people with the same illness.
Hello all, how are you, all right?
At Portcullis House, the group meet with MP Chris Elmore, who's chair of the new parliamentary group.
Nice to meet you. Thank you for coming in.
He was bullied as a child and wonders how he would have coped if that bullying had continued via social media when he was at home.
This is a public health issue and that we do need to start addressing the fact that we have a whole generation of young people that have become so used to using social media as an interactive platform that we need to address it. Across party, across government, it needs to be a response to something that at the moment we're not dealing with as well as I think we could be.
MPs, along with RSPH, will now gather further evidence from charities, mental health organisations and schools. Once this inquiry is complete, the group may recommend changes in the law to help young people who are so afraid of missing out online they risk missing out on real life.